Good morning. My name is Dr. Jen Bambro. I'm a doctor of physical therapy and a board certified neurological physical therapist. I wanted to share with you a little bit this morning about my journey with Nutcracker syndrome and May-Turner syndrome. I'm about 6 weeks out from a left renal vein transposition and external stent for May-Turner. And I wanted to share a little bit about the importance of scar tissue mobilization and how much it's played in my return to function and my control of pain. So, scar tissue is a normal, natural, healthy way that the body uses to repair itself. Our skin normally moves and it kind of moves like this, and it's all kind of organized, and then scar tissue kind of comes in and plays a role like this. And so it doesn't move quite as fluently or naturally as our other tissues, and so it can kind of pull and be kind of cranky and yucky and feel kind of gross. And so we tend to have some pain at scar sites, and when you try to move, it pulls and it can feel really horrible. And so for me, I had a lot of tenderness and grossness at my incision site. Well, I had a 7-inch incision in my stomach. Why wouldn't I have tenderness? And so I have, as soon as my incision was healed, that's a big important part, is wait till it's healed and you're no longer at risk of infection, is we start having to work on getting this kind of turned into a little bit more willing to move like this. So I'd like to show you a little bit about how I have worked on my incision so that it can move a little bit more like this. I don't have as much of like this going on. So as you can kind of see, my fingers are a little bit loosey-goosey. So I tend to avoid using straight fingers when I'm working on my incision because I want to protect my fingers. So I use a lot of palm or knuckles. So that's a good way to protect your hands. And as always, if you're going to try this on yourself, make sure to consult your own doctor of physical therapy at home or your doctor or surgeon before trying any of it. And I tend to have really sensitive skin, so I like to use something natural like my skin will kind of make. I have shea butter here, I have vitamin E, I also like jojoba oil. You'd have to choose something that your skin wouldn't be angry about. So you can see if my incision goes kind of here to here, and I've done a lot of work on it. I'm going to choose my vitamin E oil today because it has some healing properties that I find helpful for myself. Just putting a little bit in my hand and just kind of lay in a comfortable position. I'm going to kind of stay sitting up so you can see. Palms of my hands, and you have to respect your body. Always make sure to respect your body. And I'm kind of doing pushing side to side. You can be really gentle, or you can kind of get deep in there. So kind of pushing and smushing. Remember, we're trying to encourage it to move like the rest of the tissue. So I'm going to get a little bit more aggressive. Remember, I'm using knuckles to protect my fingers. See how I'm trying to move it, and then allowing it to stretch. Because normally we move, right? We want to be able to stretch. We don't want to be stuck in this position. Right? We don't live life in that position. So please make sure to ask any questions that you have. I'm happy to respond. And if you have any other ideas of something that you'd like to see, let me know those too. And have a great Monday.